Hi there. In this video, we're going to look at how we now arrange follow-up for patients. Now, maybe they can book themselves in using appointment links, but it might well be that they call up to book. And in this scenario, the green A is our friend, or if you've got it configured, it might be that you just immediately see this pop up on the screen when you retrieve the record. We're putting this now into a form that you can just read out. So according to our records, you are due an appointment with a clinician. Can we book that for you now? It might sometimes list other things as well, like to review your diabetes, but hopefully it should be in a format you can just sort of read out for the patient. Now, it may be at this point the patient says, actually, I was seen recently, do I need it? So we would then click on info to get more information. And here in the follow-up notes, I can see that it was arranged on the 10th of July, and it's to discuss a clinic letter. So it may be the patient says, yep, I have come since then, it's been discussed, and that's fine. Or they might say, oh no, that is needed. Either way, if we cancel this and come back to this option, we can put either completed to say they've completed it, decline to say they don't want the follow-up, or book. If we click book, this should be fairly familiar to you now if you're using our recall system, that it's advising you to book an appointment using free slot searches. We'd recommend, if you're going to use this in your practice, that you configure free slot searches to match with this sort of phraseology. We use clinician in our practice to mean either a GP or an AMP. It might be in your practice, it will say GP. There's options to kind of configure that, and there's some things about using appointment templates. Again, similar to the recall system, using those can just make it really clear to the system that the patient's booked and we don't need to follow them up any further. That's about it really for booking the appointments. Hopefully this helps and reduces the kind of confusion around why patients might need appointments, reduces the tasks in your inbox. And as ever, let us know any feedback or anything you'd like help with. Thanks.